In epidemiology, you're oftentimes dealing with graphs or tables or numbers that you simply can't see the faces. So it's important to be grounded and forced to see the faces.
Pity stems from a feeling of superiority. You are above looking down on another person. And compassion means passion with having to do something with someone, not for someone.
That it's the human face that really awakens the infinity of promises that we owe to one another.
To understand the vulnerability of the human condition and how significant it is when you can see that what you're doing has a human dimension and an important value to caring about the clients and the patients and the families as much as you care about the medical intervention, and that it has to be generous and compassionate and inclusive.
Dr. Gloria Esegbona was motivated by compassion to return to Nigeria to work with women who suffer from obstetric fistulas. She was impressed by their incredible dignity and was in turn honored to have an opportunity to work with them.
These women need help, and people need to get together and start addressing this problem, because it is a problem which is totally unacceptable in this day and age. These women should not have to go through this. As you can see, the women sitting here, they're women full of dignity. They're strong women, they're not weak women. The fact that they've actually made this journey, and some of them have traveled hundreds and hundreds of miles to get here, shows you that they can and will seek help if the help is available. Obviously, the situation we have is that they're not able to seek help as and when they need it for socioeconomic reasons, but they are here and they are strong women and they are proud women. So let's help to maintain their dignity.
The benefactors who are trained in healthcare go to meet people that they've never known before, that they may never see again. And they go there because these people have not cried out for help, quite often not even knowing that help is available. It's the person-to-person contact that arouses a sense of compassion and love and care that is almost unique in the public political world.
My baby means the world to me. When my baby is sick, I'm also sick. I can't eat, I can't sleep. But when my baby is healthy and okay, I'm also okay. I would love him to be healthy so that he can concentrate in school. He can do well in school. I'd love him to go to the university.
These are people who live on less than $1 a day. These are people who are trying, barely scratching the bottom. But you walk around, you see happy children, you see happy faces. These are people who sometimes are held back by disease. Diseases that we can change. Diseases that have got medication. Diseases that are easy to control. And it is the work that we are doing here, it is the work that people are doing here that is helping to make that change. Kibera people are very resilient people, very tough, but they need that help. They need that extra push. They need that public health professional out here, going through the mud, working under very difficult conditions to be able to make that change.
I do the work I do because I love to do. I love to talk to people. I love to listen to people. This is something that has to be new, because remember, we are dealing with human beings. And if you don't have that passion, there's no way you're going to do it. And I want to believe that as a health worker, I also have a passion for this work that I'm doing. Compassion is taking care of the whole society.
We all have ideas, but we don't talk about compassion. As we looked at the definitions, how inadequate that word turns out to be. The definition in the dictionary and in the materials we have received talk about two things. One, the sharing of suffering and the desire to alleviate that suffering. And it seems to me that's really inadequate, because everyone could have compassion and nothing would change. And I think we should be thinking instead about delivering something, consequential compassion.
Yeah, anybody who wants to help young people who live in situation like this, they have to come and see what young people have to go through every day, and the kind of stress that they have to go through and they have to put up with every day.
Communication, violence.
Yeah, I think that young people relate to young people better. We use games as a way of breaking, the whole stigma behind. We don't just want to push it on them to say what is HIV. We want to use game to make them comfortable, because if they're not comfortable, they won't talk about it.
Come as soon as you can. All right, let's grow again.
The right way to do it is to explain what are some of the dangers. So you need to explain step by step, and I think that what causes a lot of HIV cases is that parents and guardians or adults don't talk to young people about HIV/AIDS.
Elders, don't be afraid to speak to the youth.
Condom distribution has been an important part of our work. In the early stages, the accent was on distribution of condoms. And I guess quite naively we felt that as long as people had condoms, they were safe. The truth is that we have learned that that isn't so. Some of those issues have to do with the negotiation power that people have in a sex act. So who has the power? Who can insist on the condom being used?
It's pathetic to say that after 20 years, we are still having 5 million new cases every year. Which means what? It means that we fail probably to make drugs available to those people, to prolong their life. We fail certainly to bring necessary information which is needed to prevent those millions of people to be infected. Most of them are young people.
I lose patience profoundly with the statistical documentation, because it always leads to abstractions. Everything is in the millions, whether it's people or dollars. But what you're really doing is fighting to save individual lives. You're fighting to overcome the individual human predicament. When I'm in Mozambique, as I was just a few weeks ago, and I visit the Beira General Hospital, and I walk into the women's ward, and there are 54 beds, but there are 80 to 90 women in the ward. All of them young, all of them in their late teens, 20s and 30s. All of them, almost all of them, with AIDS-related illnesses, and most of them co-infected by tuberculosis. And they're lying on the concrete floor of the corridor, and they're lying on the floor between the beds, and they're lying on the floor under the bed, and they're lying two to a bed, and the families are in the room, and there is a kind of Kafkaesque contagion of death and despair, which is unbelievable. And you stand at the door of the ward and you think to yourself, the world has gone mad. How is this possible? How is it possible that in the year 2006 we can be losing so many young women unnecessarily? We have the drugs to keep them alive. How is this possible? And you know that it's happening because of the failure. The failure of the world at the level of the country to join together to respond to the pandemic, to defeat it, to collaborate with each other in the service of keeping these women alive, so the orphans aren't left behind, so that young women have a life to lead. It's not snuffed out in agony.